Hi class, this is Dr. Heather Austin Robillard, and this lecture is going to be about activity disorder. Unlike the eating disorders that we've covered thus far in this semester, activity disorder is not actually recognized by APA as a full threshold or subthreshold disorder, meaning it isn't included in the DSM as a diagnosable eating or feeding disorder. Despite the lack of consideration of activity disorder by the APA or in the DSM, researchers estimate that anywhere up to 75% of those with anorexia or bulimia engage in excessive exercise to reduce their anxiety about weight management and to compensate for their eating behaviors. In this lecture video, we're going to learn about activity disorder characteristics, the risk associated with excessive exercise, and the common cognitive distortions that reinforce this behavior. Activity disorder is also referred to as a pathogenic exercise and exercise addiction. The purpose of recognizing activity disorder as a legitimate issue is not to pathologize healthy behavior or those who are active, but to understand how exercise can become addictive when the behavior is done excessively and is done despite medical risks that may be occurring. A key to understanding excessive exercise or activity disorder is that when it is typically healthy behaviors are taken to the extreme. Individuals will continue to exercise in spite of medical and or other consequences, feeling as though they cannot stop or cannot skip an exercise. There is reported feeling of being consumed by the need for physical activity to the exclusion of everything else. Terms commonly used are activity disorder, excessive exercise, pathogenic exercise, or exercise addiction. Some characteristics of activity disorder are that individuals who have signs of activity disorder will be compelled to engage in exercise, not for the enjoyment purposes, but for the need to maintain their weight and reduce anxiety related to their distorted thinking about their body or about their eating disorder. Persons with activity disorder maintain a high level of activity and they are uncomfortable with the states of rest and relaxation. There is an intense, driven quality to the activity which becomes self-perpetuating and resistant to change. It compels the person to continue while feeling the lack of ability to control or stop their behavior. It is important to understand that the context is important. A professional athlete is likely to engage in exercise activities to a greater proportion of their day than most people. But this is due to professional obligations and personal goals within their sport. To understand whether someone is suffering from an activity disorder, we need to have a good understanding as to why they engage in those exercises. Only the overuse of the body can produce physiological effects of deprivation, an important component perpetuating this specific disorder. There is no particular personality profile for this disorder. However, these individuals are generally viewed as healthy, high-functioning individuals. These individuals are likely to have an achievement orientation, independence, self-control, perfectionism, persistence, and well-developed mental strategies that can foster significant academic and vocational accomplishments. Disordered persons will use rationalizations and or other defense mechanisms to protect their involvement in their activity. This may represent a pre-existing personality disorder and or may be secondary to their physical deprivation. An individual who is suffering from an activity disorder will have similar distortions in their thinking as someone who is suffering from an eating disorder. These distortions help them reinforce or support their continued engagement in excessive exercise. For example, they may experience dichotomous thinking. If I don't run, then I can't eat. They may use selective abstraction. If I can go to the gym, then I'll be happy. They may use magnification, like if I can't exercise, my life is going to be over. They tend to overgeneralize, like my mom, people who don't exercise are fat. They participate in superstitious thinking. I must run every morning or something bad will happen. And they personify. People are looking at me because I'm out of shape. They may also participate in arbitrary inference. People who exercise get better jobs, relationships, and so on. Or they use discounting. My doctor tells me not to run, but she's flabby, so I won't listen to her anyways. Excessive exercise can become problematic as it can cause serious health risks ranging from mild to severe. One of the most common issues related to over-exercising, which is often associated with competitive athletes, include fatigue, reduction in performance, decreased concentration, inhibited lactic acid response in their muscles, loss of emotional vigor, increased compulsivity, soreness and stiffness, a decreased maximum oxygen uptake, decreased blood lactate, adrenal exhaustion, decreased heart response to exercise, hypothalamic dysfunction, decreased anabolic or testosterone response, increased catabolic or cortisol response. It is hard to have an accurate estimate on how many people suffer with excessive exercise, since this is not formally recognized as a diagnosis. Researchers and clinicians both acknowledge that the signs and symptoms of activity disorder occur for those who are living with anorexia nervosa or bulimia nervosa. It is believed that up to 75% of those living with bulimia nervosa also engage in excessive exercise. Outside of those diagnosed with an eating disorder, we do not know much about the prevalence rates in the general population. We do know that men and women are just as likely to have activity disorder, and it probably is not diagnosed often enough. Some risk factors for activity disorder include the family culture. This can be seen as a risk factor when families or family members, particularly parents, who model obsessive compulsive exercise or dieting behaviors. When children associate acceptance with being thin and fit, they may develop faulty thinking. These cognitions can focus on their self-esteem being tied to their fitness and thinness, which cause them to engage in excessive behaviors. Families can use the term like no pain, no gain, which emphasizes that they should ignore their body's warning signs about overtraining and push through to reach their goals. Personality factors related to perfectionism, overachieving, and those who are more likely to express self-deprecating views of themselves may seek out exercise to get the perceived acceptance from society about being fit and thin, and this behavior can often become very excessive. We do know that those with activity disorder have similar brain level processing as other eating disorders. This is the end of the activity disorder lecture. You were able to learn about signs and symptoms of activity disorder and different risk factors that might cause someone to develop an activity disorder. I hope you enjoyed this lecture.